Angelica Simmons-Wade,
Welcome everybody to episode 81 of Spurbs Herbs. Today we're doing a Chinese herb Xin, or Asari Herba, also known in English as Asarum or Chinese wild ginger. And it's going to be a wild time, so it's going to be useful. Let's see what we're doing today. And today we will be exploring another interesting Chinese herb, Xin. I just said all this, Asari Herba or Asarum or Chinese wild ginger. This herb is in the Chinese medical subcategory of warm acrid herbs that release the exterior under the category of release the exterior herbs. Or is it? One of our books disagrees with this. Let's see what that means. It can be an important herb in certain circumstances, especially as a potential substitute for some of the functions of the banned huang or ephedra. But is it safe? Is it readily available or is it banned? We're going to find out. And as usual, we will be exploring something a little different. We're going to talk about treating hypertension from more of a biomedical point of view rather than a Chinese medical point of view. Please stay tuned for this intriguing episode. Before we get into this, I would like to take a moment and remind y'all, I've been teaching for quite a while now on a wide variety of topics. If you like this podcast and you want to explore more of my courses, they are available at www.integrativemedicinecouncil.org. That's Integrative Medicine Council, COUNCIL.org, and include a ton of different topics, including my drug herb series, looking at drugs and how they interact with herbs and vice versa, which we're going to cover a little bit about here today. Several ethics and safety courses, Chinese medical research, several treatment of condition courses such as arthritis, neck and back pain, COVID, and depression and anxiety, and one of my favorite courses, the Chinese Herbal First Aid Kit. And they're all at a reasonable cost, and you can get an additional 20% off with the code SH20OFF, that's SH20OFF. So they're already easy, they're already pretty good on the pocketbook. They're reasonable than a lot of other potential courses, but you can get an additional 20% off, making it super reasonable with that coupon code. So let's talk about treating hypertension before we get into today's herb. I just updated my cardiac drugs in Chinese medicine class in my drug herb series based on my book, Integrative Pharmacology, combining modern pharmacology with integrative medicine. In this course, we discussed the definition of blood pressure and different pharmaceuticals used to treat it when too elevated, which is known as hypertension. And I thought it would make an excellent little something different for Spurbs Herbs. So here we are. So hypertension confounds many cardiac conditions, which is important because cardiac deaths are the number one cause of deaths in the U.S. for sure, and I believe in most developed nations. So very, very common. So we need to do this. So hypertension confounds many cardiac conditions, and is quite prevalent in the population with elevated blood pressure affecting approximately 45% of adults in the U.S. Now, that's huge. 45% of adults is a massive number of people that might be affected by hypertension. However, it's elevated blood pressure. It's not technically hypertension. And it seems to me like when I started, hypertension was over 140 over 90. It is now, this elevated blood pressure is between 120 and 129, and I believe 80 and between 80 and 90. So they've brought it down quite a bit to make this definition of elevated blood pressure. But it's based on science, so hopefully it does say something. Antihypertensive agents are used to lower blood pressure. Blood pressure, or BP, is determined by multiplying cardiac output, CO, and total peripheral vascular resistance, or TPR. So blood pressure equals cardiac output times total peripheral resistance. Total peripheral resistance is mostly based on blood vessel tone, the state of the muscles and arteries and capillary beds. To a lesser degree, the total peripheral resistance is also determined by intravascular blood volume. So more blood in the vasculature means more back pressure. Total peripheral resistance is sort of back pressure from what's out there. So if those arterioles, those arteries, those small arteries and capillary beds are really tight, there's a lot of back pressure that happens. Also, if there's more blood in the vessels, it means higher total peripheral resistance. Cardiac output is itself a product of stroke volume and heart rate, stroke volume being SV and heart rate being HR. So stroke volume is how much blood is being pushed through contraction of the heart and is determined by heart muscle contractility, which means how hard the muscle squeezes, and the amount of venous blood that returns to the heart called preload. The HR is simply how fast the heart is contracting. So how hard it's contracting and how fast it's contracting is what makes up the cardiac output. From these equations, there are three main controllers of blood pressure in the body: the heart, blood vessel tone, and the kidneys. The heart can control blood pressure by regulating the speed and force of contraction. Blood vessel tone changes that total peripheral resistance. And the kidneys control blood volume and therefore can affect stroke volume, cardiac output, and total peripheral resistance. We didn't get into stroke volume too much, but there's something, or did we talk about preload a little bit? No, yeah, we talked a little bit about preload. So preload is if there's a lot of blood volume and that goes to the heart stretches a little bit, and with that little bit of stretch, it contracts much harder than it would without that little bit of stretch. So higher preload means higher stroke volume. So that's why it can affect all these things with the kidneys. And that's important because we find when we start looking at drugs, the kidneys are kind of the main thing we look at. So all classes of drugs that affect blood pressure act on these areas below. So that's the heart, the blood vessel tone, and the kidneys, those three areas. The most common antihypertensive agents are the diuretics, which work on the kidneys to reduce intravascular blood volume and therefore stroke volume and total peripheral resistance. Beta blockers decrease contractility of the heart muscle to reduce cardiac output, technically stroke volume, and affect the renin-angiotensin system to reduce blood volume and therefore stroke volume, cardiac output, and total peripheral resistance. Angiotensin converting enzyme or ACE inhibitors cause vasodilation and affect the renin-angiotensin system, causing changes in total peripheral resistance, stroke volume, and cardiac output. Angiotensin II antagonists act similarly to ACE inhibitors. Calcium channel blockers are generally an alternative choice for treating hypertension due to adverse reactions. They work by reducing the contractility of the myocardium and thus stroke volume and cardiac output. So that's a really brief introduction to the basics of hypertension and the basics of how we might treat it. I talk a lot more about it in my course, but this is a good little, amuse-bouche. And then let's get into today's herb. There's a lot to talk about, which is why there wasn't a ton of a little bit different. But let's start talking about today's herb, Xixin, or Asarum, or Chinese wild ginger. It's in the family Aristolochiaceae, which we're going to find out is actually important for us to kind of know that this family is there. Aristolochiaceae. There are several standard species that can happen here, and they have their different Chinese names. So one species is Asarum heterotropoides, Fr. var manchuricum. So I don't know what FR means. Var means variety. So this is a subvariety of this species. And that variety is called manchuricum. And there's maxim period in parentheses. That means that was the oldest botanist that classified this. And Kitag, Kitag, is the botanist that actually put it in its current place. So that's where those names come from. The Chinese name for this particular species is Bei Xixin. Another species is Asarum sieboldii, and this is Mick and a var, so it's a variant, Seulens, Seulens, S-E, and Nakai is the botanist. And in Chinese, this is Han Cheng Shi Xin. And then there's that non-variant of the same species, Asarum Sieboldii Mick, but no variant, so no subvariant of it. And this is in Chinese, Hua Shi Xin. So medicinal part is the whole herb. The English translation is thin acrid. That's what Shi Xin means, thin acrid. And the thin refers to the little rootlets that are there. They're very thin, and it's spicy, so acrid. Okay, let's talk about some of the names, and then we'll have a little note about them. So other names for this is Asarum, Azarum, Cabaret, false colt's foot, hazelwort, public house plant, snake root, xiaoxin, which literally translates as small acrid. That came from the Shendong Bensao Jing, which we're going to talk about in just a minute. In Japanese, it is saishin, and in Korean, seisin. Again, I don't know how to pronounce Japanese or Korean. And there are a lots of different names for each species, which are too numerous to list here. Like each subspecies had like 4 or 5 names in Chinese of it. So it got really complicated really fast. So I kept it a little bit simple here with all the different names. So let's talk about that Aristolochiaceae family. The Aristolochiaceae, or birthwort family, has 7 genera and about 400 species of flowering plants. The plants are perennial with simple leaves which are spread out and grow alternately along the stem on leaf stalks. They do not have stipules, which are little bulbs under the leaves. The flowers are bizarre, medium to large size, and are bilaterally or radially symmetrical. And several members contain the toxin aristolochic acid, or aristolochic acid. So that's kind of the main thing we need to be worried about. Well, we think is one of the main things we need to be worried about. Any herb that's in this family is this aristolochic acid, which can be quite harmful, and worldwide there's definitely been quite a few deaths caused by aristolochic acid. So the question becomes, does Shi Xin have aristolochic acid or not? And we're going to be answering that question. So let's keep that question in mind. And the reason why I'm harping on it here as we're talking about the family is the family is Aristolochiaceae family. So it actually has that aristolochic in the name of the family. So that's why it's important for us to talk about it in terms of the family. Okay, so going back to the individual herb Shi Xin, or Asarum, Bensky and his team. So we have 3 main texts. One is by Bensky and his team. We have Chen, and then we have Brand and Wiseman. So those are the 3 texts we keep referring to. There are some other texts we use quite frequently and will be using in this context as well. So Bensky and his team say the dosage is 1 to 3 grams. Chen agree with 1 to 3 grams in decoction, or 0.5 to 2 grams in powder. And Brand and Wiseman also say the dose is 1 to 3 grams in decoction, but 0.5 to 1 gram in powders. So the Chen will go up to 2 grams in powders. Brand and Wiseman says only 1 gram in powders. Dosing is really important for this herb. So this is much lower dosing than a lot of herbs. Most herbs are anywhere from 6 to 15 grams. And commonly 6 to 9 grams are very commonly used for most herbs. So when it's definitely below that, and we're going to see some warnings about dosing, then it's a concern. So this is much lower dose than standard. So the category is interesting. Bensky and his team put this herb in the warm acrid herbs that release the exterior subcategory under herbs that release the exterior category. Chen, however, differ, and they say it is in the interior warming herbs category, and Brand and Wiseman say it is warm, acrid, exterior resolving medicinal under the exterior resolving medicinals category. So slightly different translation, but they basically, Bensky and his team and Brand and Wiseman agree with where this herb should be. Chen says no, it actually is in interior warming herbs. It's not in the release the exterior bunching of herbs. And we're going to talk some more about that when we talk about commentary from Chen. All three of our sources say it is acrid and warm and enters the lung, heart, and kidney channels. Chen and Chen say it is slightly toxic, and Brand and Wiseman similarly say it is mildly toxic. So right there, we're starting to talk about the toxicity of it, and that's an important conversation when we're talking about this herb. The history of this herb, both Bensky and his team and Chen say the original source for this herb is the Shendong Ben Saojing, or the Divine Husbandman's Classic of Materia Medica in the 2nd century CE. We discussed this book a lot. It is the first written book that still exists on individual herbs. And so if an herb is in this, an individual herb is in this book, it means it's among one of the oldest books, one of the oldest herbs in the Materia Medica. So this is there. So let's talk about herbs that release the exterior in general, and then we'll talk about herbs that are warming and release the exterior, warm and acrid and release the exterior. So we've now discussed this category and subcategory of herbs several times during our adventures examining Chinese herbs. In fact, 2 episodes ago, we did the same thing. We're going to repeat that information here just in terms of completeness. So according to Bensky and his team, exterior releasing herbs are those that release disorders lodged in the very superficial levels of the body. When external pathogenic factors, including wind heat, wind cold, wind dampness, and summer heat, invade the body, they first attack its superficial exterior aspects. Symptoms associated with the exterior then appear: chills, fever, headache, stiff neck, and general muscle aches. Sometimes sweating will appear, which resolves the condition, in which case no treatment is necessary. At other times, however, there will be an absence of sweating, or even though there is sweating, it is not accompanied by any change in the condition. At this juncture, herbs that release the exterior are used. Most exterior releasing herbs are diaphoretics, that is, they release or expel the external pathogenic influences through sweating. There's a saying in Chinese medicine: when the disease is in the skin, sweating will bring it out. When a disease progresses slightly further into the body, it is said to lodge in the muscle layer. The clinical presentation then includes fever, general body aches, and profuse sweating. At this stage, especially when the patient is sweated without any beneficial change in their condition, it is appropriate to use the subset of herbs that release the muscle layer. The most prominent member of this group is Cinnamomum ramulus or Gui Zhi. Some of the herbs that release the exterior have additional functions: stopping coughing and wheezing, controlling pain or spasms, and venting rashes such as measles. Bensky et al. Continues to discuss the subcategory of warm acrid herbs that release the exterior, which this herb belongs to. Herbs that release the exterior can be further divided by character and function into warm, acrid, and cool acrid classes. The warm acrid herbs dispel wind cold and are used for exterior disorders when the fever is mild and the chills severe, and there are other signs and symptoms of wind cold, including headache, body and neck pains, and absence of thirst. Okay, so that's a good start to everything. Let's talk about good quality of this herb, and then we'll get into its functions. So good quality, according to Bensky et al., they say good quality has many elongated, slender, grayish yellow roots, green leaves, and a hot, acrid taste. We have another great textbook along these lines called The Chinese Medicinal Identification, an Illustrated Approach by Zhao and Chen. And they say Xixin are rolled into bundles and have externally grayish-brown rhizomes and grayish-yellow roots. They are brittle and easily broken with an acrid and aromatic odor and an acrid and spicy taste that numbs the tongue. Superior quality have many roots. The different species have different average lengths and diameters and intensity of taste and odor. So depending on the species, these are variable. So with that, let's get into the Chinese medical actions of this herb. So according to Bensky and his team, sorry, I'm just pouring some water here. Shishin disperses cold and releases the exterior, an adjunctive herb for any exterior cold pattern, especially with the addition of dampness or underlying yang deficiency. This herb is often used for externally contracted wind cold when the dominant symptoms are head and body aches. It dispels wind, disperses cold, and relieves pain. For pain due to wind and or cold anywhere in the body, but particularly headache, painful obstruction, abdominal pain, or toothache. Often, the conditions are marked by wind, cold, and dampness having obstructed the muscles to the point that there is no sweating, and even the blood cannot flow smoothly. It also warms the lungs and transforms thin mucus. For cough and qi, which surges upward, as well as fullness in the chest with continuous cough from clumped qi in the chest and diaphragm. These patterns are usually marked by coughing with copious, watery sputum. And finally, it can act by unblocking and facilitating the orifices for various types of nasal congestion, oral pathology, and some types of loss of consciousness, all of which impair the clear orifices of the head. Not suggesting that here in developed nations we should be using it for loss of consciousness, but it is one of the traditional uses. So Chen and Chen say it dispels wind, disperses cold, and relieves pain. It dispels wind cold from the exterior. It also warms the lung and resolves phlegm. Additionally, it opens sensory orifices and promotes healing of oral ulceration. And finally, it relieves toothache. And Brand and Wiseman say it dispels wind and disperses cold, relieves pain, warms the lungs and transforms rheum, and opens the orifices. The Divine Farmers Materia Medica say this is a superior class herb, which I vehemently disagree with, but then again, it's hard to think that a 2,000-year-old book on herbs would be still absolutely correct today. It's not, but it is classified as superior class herb, which are herbs that should be taken frequently and don't have toxic effects and can be helpful for long-term use. This is not one of those herbs from what we know today. And the other thing that happens in 2,000 years, which may have changed, is it may have been that way 2,000 years ago, but often with selection and things like that, herbs become much stronger over millennia. And so today's herb may not and probably isn't the same herb that they're talking about in the Divine Farmers Materia Medica. Shendong Ben Zhaojing. So it says this is a superior class herb, is acrid and a little warm. Most of the current thinking is it's not a little warm, it's warm. It mainly treats cough and counterflow, headache and shaking brain, hypertonicity of the hundreds of joints, wind damp impediment and pain, and dead muscles. That's an interesting term. It brightens the eyes and disinhibits the 9 orifices. And here's that reason why it's in the superior class. Protracted taking may make the body light and prolong life. So disagree with that, but other than that, it's not bad. And then finally, that book, Chinese Medicinal Identification and Illustrated Approach, is also has some actions, and they usually are very similar to Brand and Wiseman because Brand was one of the editors on this book. So they say it dispels wind, scatters cold, frees the orifices, relieves pain, warms the lung, and transforms rheum. When I say rheum, I use that in Brand and Wiseman too. That's R-H-E-U-M, not R-O-O-M. So rheum, as in in the others, they instead of rheum, they use the term phlegm. So I think rheum is a nicer word than phlegm, but a little bit more obscure. Preparations. Bensky has a good discussion of a couple preparations. The first one is the Asarum powder or Shishin Mo. Dried well and powdered, this is usually applied externally, including the oral cavity. And then there's prepared Asarum or Zhi Shishin. Asarum is fried over a low flame with honey until the honey is absorbed. This method of preparation is no longer common. The honey frying reduces the herb's drying and dispersing properties, so that it warms the lungs and transforms thin mucus without injuring the yin. It is thus appropriate for treating the elderly or those with weak constitutions. Western uses, hard to find. The PDR for herbal medicines does not have an entry for this herb. RX List, which is a website, says it is used for bronchitis, bronchial spasms, and bronchial asthma. It's also used to treat coughs, pneumonia, chest pain, angina, migraines, liver disease, and dehydration. Some people use it to cause vomiting. Women use it to start their menstrual periods and cause an abortion. Please take this list with a little skepticism, as it does not list any specific species and can be discussing an herb, the same genera, but different species. Because, in Chinese medicine and anything I read, there's nothing about the menstrual periods or abortion or vomiting would be one of the signs of toxicity. So I'm a little concerned about this list, but it's something, which there wasn't a lot of out there. Dharmananda, he has a great article. We're going to talk a lot about his article in a little bit, but he describes the Western use of a similar but different species of Asarum readily growing in Europe and North America as stimulant, carminative, diuretic, and diaphoretic. So stimulant means stimulating, it kind of stimulates the sympathetic nervous system. Carminative means helping with cough. Diuretic means promoting urination, and diaphoretic means sweating, promoting sweating. So similar to our Chinese, which makes sense because he's well versed in Chinese herbs. All right, let's get into some commentary. There's a lot of commentary here. So I have a question. What about the herbs Tianma and Goteng? Are they good for treating hypertension? Yes, they are really good. Those are kind of my go-tos for treating hypertension. This is, I think, going back to our original discussion on hypertension, which was just an overview of it. If I'm going to work on hypertension from a Chinese point of view, I often will consider Tianma and Goteng. Tianma and Goteng Yin is a formula that's very good for hypertension. It's not always what I go to, but certainly one of my first thoughts to look at for the patient in front of me. So good question, Kalina. Thank you. Okay, Shishin. Commentary. Lots of commentary on this. So Bensky and his team, as usual, has an excellent and extensive commentary on this herb. The ability of Asari Herba Shishin to induce sweating is rather weak, so it cannot serve as the chief herb in an extra releasing formula. Similarly, when used to warm the kidney yang, it is also generally used in an adjunctive capacity. The perfect example of this is the formula ephedra, asarum, and aconite accessory root decoction, or ma huang Shishin Fudzitan, where externally it assists the sweat-inducing action of ephedra herba or ma huang, while internally helping aconite, radix, lateralis, peperare, Jurafudza warm the kidneys. Chen Shirduo says of this herb, it benefits the orifices and clears phlegm, alleviates watery eyes from wind, but Shishin can only be used in small doses, not large, and it can only be used in concert with other herbs, not by itself. An excessive dosage will exhaust the qi and increase the pain. Used alone, it will finish the qi and end life. There's no room for carelessness. It might be asked, since Shishin can warm the kidneys, it must be tonifying. How then can it disperse qi? The answer is that Shishin is a yang herb, rising, not sinking. Although it warms the fire of the kidneys below, it does not warm the water of the kidneys. The nature of fire is to flare upward. Shishin warms the fire and thus causes it to ascend. This is why it cannot be used in large doses. Others may inquire, if Shishin disperses true qi, how can it be effective for headaches? The answer is that the head is the capital of true yang. If clear qi rises and turbid qi descends, then the head and eyes are clear and crisp. It is only if turbid qi rises and clear qi descends that the eyes and head are heavy, aching, and painful. Shishin qi is clear and not turbid. Thus it brings down turbid qi and lifts clear qi. This is why it cures headaches so miraculously. However, its flavor is acrid and its nature is dispersing. One must use it with herbs that tonify the blood so that there is no blood, so that there is blood to prevent qi from dispersing excessively. So going back to the commentary from that quote, there is an adage about this herb to the effect that it should not be used in dosage larger than 1 qian, or about 3 grams. However, this was taken out of context. The source of the adage, alternative statements in Materia Medica, are the Ben Sao Bie Shuo, Ben Sao Bie Shuo, written in 1086, refers to the use of the herb by itself as a powder. There are physicians who report good results in difficult cases using large doses of Xixin, but those without extensive experience in the use of this herb should be wary and err on the side of caution. Some traditional herbal pharmacies use Xixin as a non-toxic alternative to camphor for the preservation of herbs, especially ginseng. Small portions are simply wrapped in a cotton cloth and placed in the corners of the storage space. So that was the commentary from Bensky and his team. Chen say Xixin has potent effect to dispel wind cold from the exterior and warm the interior. Depending on the reference, it has been classified as either an exterior releasing herb or an interior warming herb. So that's the reason. The other two books, exterior releasing herb, Chen classified as interior warming herb. I love when they disagree. We learn a lot with that. Okay, let's talk about some comparisons. Bensky and his team do not compare this herb with any others. However, Chen and Chen do. And they compare Xixin and Ma Huang Herba ephedra. Both function to warm the body and dispel wind cold. Xixin is penetrating in nature and more strongly warms the body while mainly relieving pain of headaches, body-wide muscle aches, and pain caused by wind cold. Ma Huang is dispersing in nature and more effectively disperses wind and releases exterior conditions. It is the strongest herb for treating wheezing and dyspnea in wind-cold invasions where there is no perspiration. So Xixin can be useful when there is no perspiration, as we talked about when it hits the muscle layer, but Ma Huang is much better. So one of our questions when we started this was, can Xixin help replace some of the functions of Ma Huang? And I think the answer to that is a little bit, yes. Not a lot. As you can see here, not a lot across over. There's really no good substitution for Ma Huang. I wish there was, because I can't tell you how many times I'm lecturing in one of these courses. Ma Huang is called for in a formula, and I don't have any suggestions because Ma Huang is banned. It is not allowed in the U.S. It's not allowed in most developed countries at this point. And so, what do you use as a substitute? Well, Xixin might be able to substitute some little bit of the function of the Ma Huang. Problem is, Xixin is not readily available. For example, I just had to take it. My herbalist, I don't ever treat myself. That's one of my roles. I just had the flu and then I had a cough afterwards, and my herbalist wanted to put Xixin in my formula. I couldn't find it anywhere. I didn't go into Chinatown and ask for it as a raw herb because I use granules for the most part, and everything was granules in this. Could not find the granule or anything with granules that included Xixin. So it's really kind of, you can get it. You can always ask for it, and a lot of people go under the counter and get it, even though it's a little questionable, but it's not easy to get in general. So Xixin is not a great substitution for Ma Huang, one on the function end of it, but also on the availability end of things as well. Okay, that's comparisons. Let's talk about some combinations. Bensky and his team combines this herb with 4 others. There's a lot to talk about with these. So the first one is Aconites radix lateralis preparata, or Jerfudza. So that is a warm the interior herb. So remember, this can be considered a warm interior herb. It is by Chen. So this pair is frequently used for dispersing cold and stopping pain. As explained in Rectification of the Meaning of Materia Medica, or the Ben Sao Zheng Yi, written in 1914, so relatively modern. Xixin's aroma is most potent. Therefore, it excels at opening clump qi and disseminating constraint and stagnation. It can reach the vertex, unblock the eyes and ears, and reach laterally to the 100 articulations. That's the joints. There's no subtle area it does not reach. Internally, it dredges the collaterals and channels in order to unlock the joints exteriorly immobilizes the orifices of the pores in order to directly vent the muscles and skin. So that's the quote. When the two herbs are used together, their common warmth combines, their ambulatory nature facilitates movement, and the effect is to disperse cold and alleviate pain. Internally, Aconitum radix lateralis preparata, or Gerfudza, warms while Shishin draws out the cold and disperses it. Exteriorly, Shishin dredges up the pathogen, while Aconitum radix lateralis preparata, Gerfudza, encourages and supports this action. Thus, cold at any level can be completely eliminated. Clinically, besides treating cold damage involving both the exterior and interior, marked by aversion to cold, headache, and generalized body aches with aching joints, the pair can also be used in treating painful obstruction from wind, dampness, and cold, leading to spasms of the joints and intolerable pain. However, caution must be exercised in the use of these herbs due to potential side effects. If the condition is not one of cold from excess, this pair should be used only with considerable caution. So that's the combination of the Gerfudza with Schisandra fructus or wuwedza. This herb is sour, warm, and specifically used for contracting and preserving. That's the wuwedza. It is particularly good at restraining the lungs and alleviating cough. Together with Shishin, whose acrid dispersing property opens the lungs, the sour restraining quality of Schisandra fructus wuwedza preserves the lung qi. The first herb opens the lungs without risk of exhausting its qi, while the second herb closes the lungs without risk of mistakenly trapping the pathogenic qi. Thus, the pair is ideal for regulating the opening and closing of the lungs, alleviating cough, and calming wheezing. It is used for patients with existing thin mucus who are further exposed to externally contracted wind cold, leading to acute wheezing and coughing up of clear sputum. The relative dosage of each of the two herbs should be based upon the duration of the disorder and the strength of the pathogen. Generally speaking, recent or early stage disorders have a stronger pathogen, in which case Shishin should be emphasized. In more chronic cases, the pathogen will have weakened, but so will the patient, and Schisandra fructus wuwedza should be emphasized in order to take advantage of its lung-preserving action. These rules are reflected in the adage, for a new cough, use more Shishin. For an old cough, use more Schisandra fructus wuwedza. And that's our combination with wuwedza. Our next combination is with Chuangshan rhizoma, or the Chinese Chuangshan. Chuangshan rhizoma Chuangshan is acrid and ideal for moving and dispersing. It can travel upward to the head, eyes, and vertex with relatively powerful wind-expelling action to relieve pain. It is considered an essential herb for headaches. Shishin also reaches the crown and excels at unblocking the nose and ears, expelling wind cold and relieving pain. Together, the pain-relieving actions of these herbs are strengthened synergistically, especially for wind cold headaches. This use has been extended to pain from wounds as described in Rectification of the Meaning of Materia Medica. Quote, Chuangshan rhizoma excels at dispersing and also travels in the liver channel, a qi herb that moves blood. Thus it disperses wind cold, treats headache, and breaks up stagnation, unblocks the blood vessels, releases clump qi, eliminates pain, expels pus, dissolves swelling, drives out blood, and unblocks the channels. Decocted together with Shishin, it treats pain from wounds caused by metal. This pair can treat swelling and pain from sores and boils or from trauma. Other herbs should be added based on the nature of the disorder: hot, cold, excessive, or deficient. And our fourth combination is with Angelica pubescentis radix, or Du Huo. Angelica pubescentis radix, or Du Huo, is bitter, acrid, and warm, dispels wind and dampness, and disperses cold to stop pain. It also enters the kidney channel and tends to treat the lower body. Shishin is acrid and warm, with a powerful wind-cold dispersing action that tends to ascend and float upward, thus acting on the upper body. Combined, the ability to expel wind-cold is strengthened, but more importantly, the actions of Angelica pubescentis radix, or Du Huo, are elevated by the Shishin into the upper body, especially the head, face, and teeth. Thus, this combination is frequently used when strong, externally contracted wind cold has caused a lesser yin headache with splitting pain that involves the teeth and cheeks. As Zhang Yuansu noted, with Shishin as chief and Angelica pubescentes radix du Huo as deputy, the therapeutic effect on lesser yin headaches is miraculous. This pair is also used for other pain in the joints and bones due to wind cold and dampness. Contents of this herb. According to Bensky et al., the contents of this herb include several volatile oils with safrole varying dramatically between species. Chen highlight essential oils 2.39 to 3.80%, including methyl eugenol, safrole, saracin, and eucarvone. There's also hygenamine and aristolochic acid. Aristolochic acid is one of the things that they highlight, which is a concern. But we're going to talk more about that in a minute. Let's talk about the science. So according to Chen and Chen, the pharmacological effects of Shishin include the following actions. Reversal of morphine-induced respiratory depression when injected into rabbits. Okay, we don't know if that does anything for humans or not. An alcohol extract increased heart rate and cardiac output. Generally, we don't do alcohol extracts of this. We either decoct it in water or we do the powder. So I don't know how relevant this is. Again, I think it was an animal study. And we generally don't want to increase heart rate, cardiac output. The essential oil can be anti-inflammatory, as shown after injection into rats, and can be a local anesthetic, as shown in rabbit injections. Okay, so those are all animals. Those were animal studies, and there have been several clinical studies, as noted by Chen. These showed beneficial effects in topically treating aphthous ulcers with an N of 106. N means number of subjects, and generally we want at least 30 to 40 to be statistically valid. And generally, the more subjects are, the stronger the study. So 106 isn't a horrible study. It's not a tiny study. It isn't the largest study either. It's not bad. So it had helped topically treating aphthous ulcers and treating angina with an N of 281 with Shishin and Borneolium, the Chinese herb being pian. So those two together was useful for treating angina. And the way they did it was interesting. They did it with alcohol and they sprayed it into the mouth. So it got supposedly absorbed quickly through the mucus, the mucous membranes there. Very interesting. Again, I don't think something we're going to deal with in the West particularly, but it's an interesting use of this herb. Drug-herb interactions. In general, literature search did not find any potential drug-herb interactions with this herb, and the American Herbal Products Association's Botanical Safety Handbook does not have an entry on this herb. So there was no obvious drug-herb interactions with this. It has enough actions on its own for us to be concerned about strong actions on its own. We're going to talk about those coming up next when we talk about concerns. There's a lot of concerns about this particular herb, so we're going to get into that in just a minute. Okay. Let's do that now. Concerns. So Bensky and his team note several concerns with Shishin. Under the heading of cautions and contraindications, they say contraindicated where there is profuse sweating from qi deficiency or headaches or cough due to yin deficiency. Under the heading of traditional contraindications, they quote from Harm and Benefit in the Materia Medica, or the Ben Sao Hai Li, written in 1893. With its ascending, drying, and dispersing nature, Shishin should not be used for any disorder involving internal heat or fire flushing upward, upper excess and lower deficiency, qi deficiency with sweating, blood deficiency headaches, or yin deficiency cough. All the methods forbid it. So under the heading of toxicity, they say overdosage of this herb or too short a boiling time during decoction can cause toxic effects. In one case, 15 grams of the herb, 5 times the suggested maximum dose, taken as a decoction caused headache, nausea, diaphoresis, sweating, restlessness, red face, tachypnea or rapid breathing, accelerated pulse, elevated temperature, cardiac arrhythmia, hypertension, opisthotonus. This is when it's also kind of it's when your back is arched and everything is extended. Everything else is kind of extended. Not a good thing. It basically means the brainstem kind of is involved. Pistotonos. Disturbed consciousness, convulsions, dilated pupils, urinary retention, and ultimately death from respiratory paralysis. So that was an overdose, and it wasn't that much of an overdose. I mean, 15 grams versus 3 grams. Like I said at the beginning of this, when we're talking about dosing, 15 grams is kind of in the realm of normal dose for an herb. Not this herb. The toxic constituent of this herb is thought to be safrole, which has shown after long-term administration to cause liver cancer in various animals. We're going to talk a lot about safrole in just a minute. This is much more of a problem with the adulterants, which have 3 to 6 times the amount of safrole as the standard substance. So again, your source is important. Where are you getting this from, and are they giving you good quality stuff? Precise species identification and the assay of safrole content is therefore necessary to avoid toxic reactions. So this might be why it's very difficult to get this herb in the US. Because the toxic constituent of the herb is part of the volatile oil, prolonged boiling of the herb reduces its toxic effects. The dosage of unboiled herb, as in pills or powder preparation, should not exceed 1.5 grams per day. So if you remember back to dosage, we said that Brandon Wiseman said maximum of 1 gram powdered per day, and Chen said maximum of 2 grams powdered per day. So Bensky is right in between those two at 1.5 grams per day. So there you go. That's the daily dosage. So there we go. We got a range there, but they're all in the ballparkish. So that's the concerns from Bensky and his team. Let's talk about concerns from Chen and Chen, who have similar concerns. Shishin is extremely dangerous when used in larger quantities than suggested or if used in powdered form. The safrole is the essential oil of shishin is responsible for the toxicity of this herb, which can be reduced or removed by cooking. So it says the same thing as Bensky. That's good. Shishin is contraindicated in patients with febrile disorders, yin deficiency, yang excess, cough or wheezing due to yin deficiency, headache due to blood deficiency or wind heat, and perspiration from qi deficiency. And they discuss overdosage. Adverse reaction associated with overdose of shishin is generally observed 1 to 2 hours after ingestion, but may occur within 30 minutes. Early symptoms include headache, increased pressure sensations in the head, nausea, vomiting, perspiration, thirst, red face, restlessness, anxiety, stiff neck, dilated pupils, hurried respiration rate up to 53 times per minute. Normal respiratory rate is about 15, 16, give or take. Elevated body temperature up to 45 degrees C. Again, normal body temperature is 37 degrees C. So that's a lot more. So if we're going to, I can't convert it in my head to degrees, but we're talking a very high fever. Elevated blood pressure up to 150 to 170 over 110 to 130. So that's considerably elevated blood pressure. Tachycardia up to 123 beats per minute, and forceful rapid pulse. As the reaction progresses, patients may also exhibit general tremors, muscle stiffness, clenched jaw, mania, jaundice, and in severe cases, anuria, which means no urination, unconsciousness, and respiratory depression. They do have, this is Chen, do have instructions on how to treat an overdosage. However, given its severity, emergency medical care is warranted. So they have all these herbs and you know what you should do, but unless you have the herbs ready to go and you're going to try them for 30 seconds before you send them to the emergency room, I wouldn't go near this with a 1,000-foot pole. This is an emergency situation. Let the emergency team handle it. Additionally, Chen state under the heading of toxicology, shishin belongs in the Aristolochiaceae family, has been found to contain trace amounts of aristolochic acid. Again, that's considered quite toxic, and so we're concerned about the aristolochic acid. And I actually think that is the main reason why it's been banned in the U.S. However, this next article kind of disputes that, and I kind of agree with it. So Subhuti Dharmananda, if you're not familiar with Subhuti Dharmananda, he is a very proficient, he writes a lot in the U.S. And I think he ran a school for many, many years. If I don't think he does anymore, I don't know. I haven't heard. I don't know what his current state is. But he has a really good article on the toxicity of Xi-Shin. And so he says the Chinese herb Xi-Shin, commonly known as Asarum, is mainly derived from Asarum cyboldii and Asarum heterotropoides. And there have been no reports of aristolochic acid in these plants. However, aristolochic acid has been found in some other species of Asarum, in the normal other species of Asarum. So that's part of the issue is there doesn't seem to be aristolochic acid in Xi-Shin, but adulterants and other herbs that are sold as Xi-Shin may have aristolochic acid. So there's some thought that the U.S. saying there's aristolochic acid and we're banning Xi-Shin may be because they looked at improper samples. So that's one of the considerations here. Okay, continuing back with Dharmananda's article. In the normal practice of traditional Chinese medicine, about a dozen species of Asarum are used as sources of Xi-Shin, making the presence of aristolochic acid in some of the raw materials and the formulas produced with them a possibility. Also, as detection methods improve, minute amounts of aristolochic acid might be found in most or even all of the Asarum species. This would be deemed reason enough for Asarum to become included in the list of herbs to be banned from use, since no acceptable level of this compound has been set or is likely to be established. The main active ingredients of the various Asarum species are not aristolochic acids. Instead, there are essential oils in Asarum, including saffrol, which we've talked about a lot, saffrol, methyl eugenol, and Asarum, which are understood to be the main active ingredients. Saffrol, methyl eugenol, and Asarum have been suggested to be carcinogenic based on laboratory animal studies. Aristolochic acid is also carcinogenic in laboratory and animal studies. So there you go. So the real issue we may have here with this herb is not the aristolochic acid. May or may not have some. Probably doesn't if you're getting good quality, but okay. But we still need to be worried about some of its active ingredients. I mean, we saw earlier that saffrol is actually, the higher level of saffrol means the more effective this herb is, but saffrol we know is carcinogenic here. So there's a lot of question marks here that we have to be worried about with this particular herb. And so I don't necessarily agree with the banning of any herbs, especially for us professionals who should know better and know how to use this at an effective dosing and all that sort of stuff, and should be relatively safe. I don't know about you. When I do use Xi-Shin, I'm very cautious about it. But it is also an important herb, and like I said, I was just prescribed it and I couldn't find it. The other herbs were fine. I got through what I needed to get through, but still. So I'd rather it wasn't banned, but I understand why it was banned. Even though if the reason why it was banned was actually wrong, because it was banned because of aristolochic acid, I don't think there's a lot of aristolochic acid in this particular herb. However, the other stuff may be bad enough for it to be banned. So I'm not horrified that this is banned. I just wish it weren't. And that is our show for today. We started with a discussion of hypertension, and then we did a deep dive into an interesting Chinese herb, Xi-Shin, Asari Herba, or Asarum, or Chinese wild ginger. We found this herb is relatively useful and powerful for treating colds and external attacks, as well as for warming kidney yang when combined with other herbs. However, there are considerable safety concerns, and proper dosage is it just as important, but incredibly important with this herb. I would say this is one of the more toxic herbs, even if Chen and Brandon Wiseman say it's mildly or slightly toxic. I just, knowing what I know about drugs, and the thing we're concerned about with drugs is what we say is a narrow therapeutic index, which is basically the ratio between therapeutic dosing and harmful dosing. And if we look at that as a measurement, this would definitely be an herb with a narrow therapeutic index, and I would definitely be very wary about using this herb. Having said that, I've used it, no problem, safely. I've used it myself, so I'm not opposed to its use, but it does need to be used safely. That's the key thing. It has to be done properly. And with that, we include another exploration of, I don't know about a very useful Chinese herb, but definitely a useful Chinese herb. So thank you. In our next episode, we will be looking at another Chinese herbal formula. In fact, we're going to look at probably the first formula most of us learn in school, Song Chi Tang, or scallion and prepared soybean decoction. This is a mild formula for releasing the exterior and may be easily created in most kitchens without any major herbal inventory. I love this formula because when someone calls up and says, I'm coming down with a cold, I don't want to come in so you don't get exposed, but do you have any suggestions? This is one of my suggestions. They usually have everything they need right then and there. One of my suggestions. As always, we will do our deep dive into this herb formula and look at its traditional uses and its preparation, interactions, and cautions. And as usual, we will be adding something a little different. It's going to be another interesting trek into the exciting universe of herbs. In 2 weeks, please join us. And as usual, I'd like to thank you very much for joining us today. If you like this podcast, please do us a huge favor. Subscribe in your favorite podcast app. That would just do a world of good for us. Thank you very much. And you can get this course as well as many others as CEUs, Continuing Education Units, and National Certification Commission of Acupuncture and Oriental Medicine Professional Development Activities, or just as very interesting courses at www.integrativemedicinecouncil.org. That's Integrative Medicine Council, COUNCIL.org. And remember that 20% off code. That's SH for Spurbs Herbs, 20 off. So SH20OFF, and you get 20% off whatever you want to take there. And you can always get in touch with me at Dr. Greg at spurbsherbs.com or at our website, www.spurbsherbs.com. Again, thank you very much. And as usual, we have a bibliography. Today wasn't super long, which was interesting. Well, there's a lot of concentrated information, so it's a good in our textbook. So good bibliography. And with that, thank you very much. The proceeding was presented by Dr. Greg Sperber. We would like to thank Janelle for all her support and everybody else who contributed to this program.
Janelle.
Timothy Dobbins,
Rogers,
Campbell.